work at it, figure it out.
Yeah.
Do it.
Okay.
Hey, all right. Episode 1, the first one.
Take one.
Take 1, 2, 3.
I'm so glad that you came out today because we have a special guest who's not only a friend, not only a band buddy. I'm looking forward to doing music with you next week. But he also is a nurse who is working with a very special part of Berkshire Health Systems. It's called the Diversity and Equity Officer. And so Charles, I'm going to let you introduce what your job title is about and what that work entails for you.
Well, thank you. Everybody hear me okay? Yeah. Usually don't have a problem projecting, but sometimes. All right. So as Lisa said, my name is Charles Redd. I've been a registered nurse for going on 30 years. And to be honest, my goal when I became a nurse was to eventually be like a chief nurse officer at a hospital somewhere. But back in 2022, I had the opportunity to work at this small hospital called Fairview Hospital in Great Barrington. And I was their director of quality. So basically, I was responsible for collecting all the data within the hospital. And I started to learn about the community and really some of the challenges in Berkshire County with health outcomes. We had very poor health outcomes in Berkshire County. We talk about chronic illnesses like cancer and cardiovascular disease. So in that, I started doing work with the state, and the state was coming up with a plan to really address those issues in the state of Massachusetts, because not only in Berkshire County did we struggle, but we were struggling across the state. So I was part of that whole planning team from different organizations across the state. So in doing that, sometime around May of 2022, my chief nurse, my CEO, kind of approached me about creating this diversity, equity, inclusion position. Now, again, normally it wasn't really in my realm of experience or something I wanted to do. But when we started to talk about how we address the health gaps and the health disparities, and understanding that different communities and different populations, their health outcomes are different than others, when that came into being and that came to be the focus, that's what drew my interest. So really what my work is really connecting the hospital or the organization to the community to address those gaps in care. So if we see that maybe a particular population isn't doing well with diabetes, well, we want to understand why that is happening. So then we go into that community and we work with that community to figure that out, and then we try to address those issues and those challenges. And that's, primarily what my role is as a diversity officer for the health system.
What are some of the challenges, though, within the communities that you're noticing, that's making so people are having a hard time accessing stuff? What are some of the couple things that you're able to address to be able to help people get more of the services that they need?
So I think one of the, when we kind of look at health in general, we try to figure out, all right, what are those challenges? And one of the biggest challenges in health outcomes is what we call our health-related social needs. It's really those basic things like housing, transportation, food insecurities, the ability to pay your bills, feeling isolated. All of these things will have a positive or negative impact on your health. And what we find is that in communities where they struggle in a lot of these areas are usually the communities that have the poorer health outcomes. So one of the things that we recognize as a hospital is we can't build houses, supermarkets, we can't give you money to pay your bills. But what we can do is, when we begin to recognize those things in our patients as they come to the hospital, we have the ability to now connect those patients to the community resources that will hopefully be able to help them. And that's why in my role it becomes so important for me to really be out in the community, connecting with those organizations, so that we can work together to really try to figure out, all right, here's a challenge, and then how do we help?
I love that you have the ability to connect folks to different resources. And I'm finding that the more that those resources are available in a town, the better off we all end up being. But I was really curious, what do you find when you go on the ground level and meet with people individually? What are you finding as you talk with these people?
So kind of when you look at Berkshire County, so Berkshire County, just to give you kind of a quick overview, when it comes to health outcomes, we're next to last in the state of Massachusetts. The other part of Berkshire County is that we're one of the oldest counties in the state of Massachusetts. So the average age in Berkshire County is 48, and then probably upwards of 25% of the people in Berkshire County are over the age of 65. And then we found that mortality rates, so that's, if we want to know what mortality rates are, that's death rates, we were one of the highest in the state when you look at cancer rates and cardiovascular disease. In one of the other areas that we kind of had challenges with is transportation. Number one concern in Berkshire County is transportation, but also housing. As we see the housing costs and rents increase, our median family income in Berkshire County is 30% lower than the state's average. So I think sometimes when people think about Berkshire County, they think about Tanglewood, they think about Stockbridge, Great Barrington, and then people assume there's lots of money in Berkshire County. Well, we do have people that have money. The majority of those people are in their 70s and 80s, but the most of the county struggles. 40% of our schools, 40% of the students in many of our schools across the county live in poverty. So, these are things that people struggle with. So, when you kind of go and you talk to people on an individual basis, it's really all of those things, like, affording your rent month to month. Getting from, if you don't have a car, getting across the state, to take the bus from North Adams to Pittsfield, that's a 2-hour jaunt, right? So if I'm a single parent, I have children in school, I have a specialist appointment in Pittsfield, I have to take a whole day off of work, number one, and then I have to figure out, all right, if I'm not going to be back in time, who's going to get my children, or do I bring my children? If I have younger children not in school, now I'm carting them on a bus, which is 2 transfers, and then even when you get off the bus, you may have to walk to the doctor's appointment. So I think it's just those things that would seem so simple to people, right? Where they're making those decisions every day. It's like, I always say to people, when we, as a healthcare system, when you come to the ER, we put you on antibiotics, right? We have this great plan for you, and then we get frustrated because a week later we see you back with the same pneumonia. Didn't you take your antibiotics? And they said, no, you're supposed to, we're scolding people because they're supposed to finish it. What didn't we know? We didn't know that person has to make a decision. Do I buy these medications, or do I feed my family? Do I buy these meds, or do I keep the utilities on? So people are making those decisions every day that we maybe didn't realize that until we started to ask the questions.
What you're sharing, in order for people to feel comfortable, they have to feel safe, and basic needs need to be met. And that's kind of what you're sharing, is even for people to get basic needs to be met is just a difficult thing. And then it puts people in a place where feeling that fear that you can either close off or kind of close down, or if not knowing the resources, being able to reach out and ask for help, that's a challenging thing too. The thought that was coming to my mind, or the question is, the state of the world that we're in right now. There's a lot of stuff going on, and people are having some strong emotions. What are your feelings of just about how things are right now in the country and how it impacts the people that you serve?
Yeah, I think the biggest challenge for me in being a part of a health system is we serve, Berkshire County it's a large, humongous county, but there's really only 130,000 people in the county, right? There's many towns and cities bigger than that, even here in Connecticut, right? So I think for me is understanding, and my conversation always has been since I took on this role is I am the diversity officer for all 130,000 people in the community, and as well as the 4,000 plus employees. That's been my mantra from the beginning. And so you have to find balance, right? Because I always understand that 50% of people, when it comes to most things like politics or any religion or anything else, right? 50% of people are going to agree with you, 50% of people aren't, right? So my job is not to really debate people on what is right or wrong or what I agree with or not. My job is to make sure that they're connected to the things that they need so they can stay healthy. So I come to understand what's going on, and really, we have angst in our community in Berkshire County. And I always say the primary responsibility of our health system is to say, we're here to take care of you. I said, we're not going anywhere. When you come to our emergency room and you need help, we're going to help you. When you have to get admitted to a hospital, we're going to take care of you. When you have to have a surgery or a procedure, we're going to be here for that. When you need, again, which they're struggling across the country, when you need a primary care visit, we're going to work hard to make sure you have a primary care doctor. So, and if you struggle with affording your medications, we're going to connect you with the people that can help you. And that's really what the kind of conversations I have. Now, people they'll share with me their frustrations of what they see or hear or experiencing, and I will always listen, because sometimes I'm the first person they get to talk to, right? If they live alone or if they live in some of our communities that are pretty densely populated. So I will always listen, but ultimately, my goal is from our health system, what do you need from our health system, and how can I connect you, or we, not just me, it's a whole organization, how do we connect you with the resources that you need right now to help you get through whatever you need to get through.
So that's a lot of people for Berkshire Health Systems to try to take care of. What does your workday look like logistically? When you show up at the hospital for your office, how is it that you logistically meet with people? Is it when they're in the hospital for care? Is it when they are looking for social services? How do you connect and have these conversations with people?
So I'm the diversity officer for the whole health system. So that's 3 hospitals and 30 plus practices. So that's primary care practices and specialty practices. So, and then if you look at Berkshire County, it borders Vermont, New York, and Connecticut, right? So could I possibly see everybody? No. So for me, and where I sit, I answer directly to the CEO of the organization. So I work with all the different teams across the system, in really trying to give them the things that they need so they can do their job. So ultimately, the things I put in place, my goal is to be able to help the people that are really doing the important work, the frontline our frontline nurses and nursing assistants and case managers and doctors, really giving them the opportunity to have the tools so they can help our patients. And then not only that, it's in building trust, right? Because if I'm a patient and I'm getting asked these questions, because we're asking a lot of questions to our patients, it's our ability to really trust in the information that we give. And I know now it's becoming harder for people to share information because whatever concerns they have. But it's really, for me, it's when I'm out in the community, is to be the face of the organization and to really begin to build that trust. So that's what I try to do. And again, we try to create things that are going to make things easier for our frontline staff to connect with our patients, and then for our patients to get connected to the things that they need.
Have a whole bunch, but here's one. You know, you said 130,000 people, 4,000 employees. How do you keep yourself sane? Like, that's a lot to care for and to know that, you know, I don't know, you're there to support them. But what do you do for yourself? How do you handle all of that, knowing that you're responsible for them, all of the people?
Yeah. Some days better than others.
I'm resonating with your answer.
It's church, right? My church family, it's, we have bands, so we do our band, that's helpful. I have friends that I stay in connection with, because that's important. It's hard because at any point in time in my job, I could be, I could be at work all day and have to go to an event in the evening, or I could be at work all week and I have to go somewhere on a Saturday, to an event or a Sunday, or so it's just really trying to find, and of course, my family and being connected to my family. One of the things I'm doing this year is with my son's on the unified track team, and that's kids with and without intellectual disabilities being able to compete in varsity sports. So he's done that for the last 4 years. And last year I volunteer coached. I'm going to volunteer coach again this year. My boss gives me that time to be able to do that. So, and that's helpful, right? I try to find time to take care of myself. Not always do I do the best at it, but but I work hard to try to do that. So, yeah.
Just a question, Charles.
Yes.
Familiar with Massachusetts, living near, got a lot of family in it and everything. Do you find that Berkshire County gets the support they should get from Boston? Seems like there's always been a bias, 495 and then inside and outside. Do you find that a real problem where you are, or are you getting the kind of support you should get from Boston?
It's still a struggle, but I think it's gotten a little bit better. Our current governor has been to Berkshire County several times. She has recognized a few of our community organizations, and we've gotten quite a few grants from the state. We got a grant to help mothers, who have substance use disorder, who need help, and we've gotten grants from the state for that. There's a local group within Pittsfield that's been recognized for their leadership training, and they got recognized by the governor of the state and got a significant grant for that. So I'm finding that more and more, we're getting that support and that recognition. I've joined a couple of, I've been involved in a couple of groups that have people in hospitals across the state. So I try to make it known about the things that we're doing in Berkshire County and some of the successes we're having. and I'm hoping that I've been part of, hopefully, then people recognize the work we're doing, and then our CEO is goes out to Boston often and really speaks to our needs. I will tell you that we're one of the few organizations in Massachusetts that we're not operating in a deficit. So, which is a good thing, and we're a nonprofit, so obviously it's not record profits like a Apple or anything, but that money allows us to get the things, to get the equipment and the things that we need to better provide for our community. So, that's a positive, and we're really trying to make a name for ourselves in that way as well. So, yeah.
Here's a fun one, just to change it up for a moment. What's a story of hope, a positive impact, something that you've seen firsthand of what you've been able to provide? If there's one, either a family that you've been able to help, or somebody that you've noticed that, like, because they received these things, it was able to help them go on to do something or better their lives or help them out.
I have to think about that because a lot of times you don't get the kind of, from where I sit, I don't get the individual stories. I think those individual successes, really, that opportunity comes for our frontline staff that are really kind of one-to-one with our patients. But what I will say is one of the programs that we have is we have community health workers. And the community health workers are connected to our primary care offices. And the role of the community health worker is to connect with the patients. So if the patient has needs, that community health worker helps support that patient in getting to those community organizations that can help them. But not only that, because often what happens is we hand the patients, call this number if you need help, and then they go out into the world, and for whatever reason they don't call the number, right? Well, these community health workers are that connection, and it's that constant back and forth communication. So what I'm hearing from the community health workers is how much of a difference that makes for the patients, because if I'm coming to you and I'm getting newly diagnosed with, let's say, diabetes, and I'm getting all this information from the physician, I have things going on in my personal life, and I share that with you, and then I just hand you 3 numbers to call. The likelihood when I leave there, new diagnosis, trying to figure all this out, have to buy these medications, have to make sure I go to the lab in 3 months, all these things are running in my head, and I have a family to take care of. What's the likelihood of me calling those numbers? Very low. Well, with these community health workers, they've been helpful in connecting the patients, helping them stay on track, helping to support them, helping to get that information back to the physician. I call it like 360 degrees of care, right? So the physician's not just hearing about the patient 3 months from now, they're getting constant communication from the community health workers about the patient throughout that time as they wait for their next appointment. So they're finding that a lot of success in that, finding it helpful. The patients are connecting to these community health workers, in a way that I think is really kind of life-changing for them. So it's really become an important role. And of course, in an important role, we never pay those people enough money to do it. But I see the joy when I talk to these community health workers. I see the joy they get from doing the work. So, so in that way, I can say that's how I get the feedback that what we're doing is starting to work. Yeah.
Charles, I know that when you were working in Greenfield, one of the things that was on your heart was to really encourage your nursing team below you, and that spawned your dignity blogs and so forth. do you get the opportunity to continue that kind of an effort with the people that you're working with to keep them encouraged in all that they're facing as together you work on this problem?
I think so. I hope so. So really, when I started, I started writing this post at this blog back in July of 2020, and we all know what happened. Probably this week, 5 years ago. So, right. So my team was sent home on March 17th of 2020. But in the meantime, we had really been working on how do we build a leadership. Our leadership scores were horrendous, right? They were like 67% out of 100. That's not a passing grade. So the staff really expressed what they needed from leadership. So one of the things that we worked hard on was to get them home, just kind of, at the start of the pandemic. But I went into the hospital every day. So how do I keep the team connected when they're all spread out all over Western Mass, okay? And then keep them productive? So I really started writing this blog on dignity as a way to show the team that, I've heard what you needed, and it was just my way of sharing, being vulnerable as a leader, right? I could still be at the front leading the charge, but I can still be vulnerable and share my experiences and share my things I did well, share times when I fell down. And in the process of doing that, I really started to connect with the team. And then as I'm writing this, it starts to get shared, right? And people are reading. I had a chief nurse officer tell me that she read these every Friday in her team meetings. Just these blogs on dignity and just about my experiences and my challenges and things that I've seen. And it just started getting shared. So when I left Bay State and went to Berkshire Health System back in July of 2021, I was thinking, how am I going to do this? And that's when I kind of started this blog. And pretty much every Friday, there's some Fridays when the brain ain't working and I can't write, but pretty much every Friday I'm writing these things. And I always tell people it's just a story. It's a letter to myself. It's really what I write, but I share that, and so on a consistent basis, people always tell me that they look forward to reading every Friday. I don't know. Well, I can't explain it, but I can't explain really to you where it comes from, because I write it on Friday. No idea what I'm going to write till Friday morning, and it always seems to be a message that touches somebody somewhere. So I continue to write it. And I think that it's gave me a level of strength to kind of get through any of the challenges. Healthcare, this work is hard. I will tell you, a lot of the health professionals still have not really and honest and truly recovered from 2020 and 2021. They haven't had the time to sit down and really talk about it because we just been running at 100 miles an hour every single day. If you know anybody in healthcare, you understand what I'm talking about. So I know that some of the nurses and some of the healthcare people that read these blogs, they find some solace in it. They find some hope in it. It's just an opportunity to think, opportunity to feel like you're heard. So it's why I managed to keep writing, and I'm very blessed in being able to do that. And this thing goes across the country. I would never have expected that. And I'm not. Somebody always tell me you should write a book. Well, July of 2020, that's like 4.5 years of pages I've already written. So it's just, who knew a person that could barely read, dyslexia, could barely write, would be able to put together 600 words and have it make sense.
Which, I mean, that almost makes me think of like two different questions. I mean, you were sharing like from your past, dyslexia, being able to read to be able to come to this point. What's something that's helped you get here to be in this position? Like, we're never do it alone. Like, it always takes a village to raise anybody, and so to be able to help you out. But what was something that really inspired you or brought you up into here? People that helped you or anything? I know,
Probably the first person was my ex-wife when I first got married. That might sound kind of funny. Charles, why are you saying the ex-wife helped you? Well, she did. She helped me because when I went back to school, and one of the first classes I took was English. And, she didn't feel that I'd be able to pass English because of some of the letters that I wrote her, and probably weren't the best grammar, wasn't the best spelling. I probably didn't talk as eloquently as somebody would think I would, growing up in inner city Boston. So that was a challenge to me, and so I took this English class, one of the toughest English teachers at the community college, and he doesn't give out A's, but he didn't say you couldn't earn an A. He said it wasn't easy to get one. And I set a goal for myself to be one of the students to get an A in that class. And I did it, one, because I'd never done it before, but two, it hurts your spirit when the person that you love doesn't believe that you can do something. Right? So I wanted to prove that person wrong. And at the end of that year, I had this great English teacher who helped me learn that I had dyslexia, and then gave me the opportunity to teach myself how to learn with a learning disability. And in that class, 2 A's happened, and I was one of them. So, it's just, so it's that, and of course my mother, who I lost a little over 2 years ago. I think as my mother started to open up about her life and about when she was young, because she never really shared that with us, me and my 2 younger brothers. I think I got a semblance of strength from that. Because it was always hard to complain to my mother. My mother raised 3 boys in inner city Boston, right? So I'd call her up and complain about work, right? Hey, let me do this, and she'd be like, son? and I said, yeah, I know. I said, it's hard for me to complain to you because you worked and you raised the 3 of us by yourself. But she would always say to me, when you get paid? I said, on Thursdays. She says, is your paycheck in the bank on Thursday when you look? I go, yep. She says, well, your job held up their end. You said yes to the job. You have a responsibility to help your end of that job. And if you're not happy, then you need to fix that. So, she just really had a way of really just keeping me focused. And then my wife, Erin, who I've been with for the last 28 years, going on 26 years, I think.
part right.
I know, look, November 21st, 1997 is when I met my wife. We danced to Take It to the Limit and How Can I Live Without You? There. Take that. You know, in my advancing my career, she was always supportive of that. You know, she stayed home with both our children until they hit to age 5 before she went back to work, and and just it just gave me the opportunity to be successful, advance in my work, and I always have that support. She really was a key part of me getting to where I am, because I had that person there that believed in me.
You were talking about Berkshire County and Massachusetts, and I thought I understood that the whole Massachusetts health system was what was creating the position that you now have. Did I have that right?
No, so the health, a lot of the hospitals across the state of Massachusetts had a diversity officer or a health equity officer in place. I think Berkshire County was one of the last healthcare organizations to put this position in place. And again, it had a lot to do with the state of Massachusetts focusing on health disparities and gaps in care amongst our most vulnerable populations. And that could be anything. That could be based on race, could be based on ethnicity, could be based on language, it could be based on neighborhood, zip code, age. There's so many variables that can cause those gaps in care. So, the state recognized that. We are the only state to have a program like this. And there's 65 hospitals participating in this program. So because of that led Berkshire Health Systems to create this position. So,
And the reason that was crossing my mind is that we in Enfield are smack dab between Springfield and Hartford, right? And people use both equally. And I was just curious grateful that Massachusetts has started that. Do we need it here in Connecticut? I don't know, because I don't have access to stats and things like that. But what about folks on the ground who are just average folks that are not in the health system? Is there something we can do to be involved in being a part of the closing that gap of health disparity?
solve the world's problems in 60 seconds. Yeah. No, I think it's just what we're doing in people that volunteer.
So there's volunteers.
Yeah. One of the, so I would say there's this group, when I first took this role, there was a group, an organization that I met, Manos Unitas. And don't ask what that means in English.
Okay.
But they were one of the first groups that I met. And they were a group of volunteers. They had a kind of a food pantry. They had a drop-in center. And they really worked out in the front lines in the community of Pittsfield. And a majority of them were volunteers. And one of the most amazing things that I saw was when we started to have the issues with housing, and I know that some of them were using money out of their own pockets to help people. Now, I'm not saying that we should be doing that. I'm just saying that that's what they chose to do, just kind of in people that had things that they needed. They would bring back to me, I had somebody that needed surgery, but they were living in their car. So, again, I was able to then start to connect them with resources. So I think, one, as an organization, we have to be out there, connecting with the community. But two, I think volunteering for, at food pantries and those types of things can really be helpful, for us. If you have neighbors that you kind of feel comfortable enough with, and they live alone, is it to outreach to those neighbors? If sometimes people want to be alone, right? I can see that. That'll be me. I'll be in my house. People knocking on my door. I won't want to see them. But it's that kind of outreach and connecting with our neighbors. I think we miss out a lot on that, right? When I was a kid, we couldn't do anything wrong. Why? Because by the time we got home, about 3 or 4 neighbors already called my mother to tell her everything that we were doing. So I think, just having that connection in your neighborhood, if you can, for people that are in need, those are the things that we can do.
This is a fun one. A fun one. A magic wand, magic wish. Yeah. If there's one thing right now that you could, whatever it was, touch, something would be able to hit, you'd be able to all right, we can do something about this right now. What's one thing that you would want to do to be able to, I don't know, wish for, to be able to help the people that you serve, to be able to help the community? I know there's more, but, one of them.
One thing? One of the hardest things about my role is that when I'm working with different organizations, and I know that a lot of these organizations really don't get along with each other, some of them, right? So I had to kind of play the balancing act. It's like being it's almost like being the head of the UN, right? You have all these different countries sitting in the room, and you're trying to play this balancing act, and I do that a lot. And if there's anything I would wish for, I would wish that these groups can set aside those differences so that we could come together and focus on what the true issues and the true problems are. Because I think it will make our jobs much easier, and it'll be a benefit to the community if we're able to do that. So if I had a wish, it's being able to get all those groups in one room and to say, all right, these are the problems, how do we tackle them?
This is probably a question that should have kind of been addressed earlier, but what's the diversity that you see mostly? Is it racial diversity, ethnic diversity? What are the people that you're...
So just to kind of give you a look at Berkshire County. Berkshire County, when you look at just that race, Berkshire County is about 89-90% white. But we have a fast-growing Hispanic and Latino population. It's probably grown over the last years about 55%. So I think probably close to 6% of our population is primary language is Spanish. We have about 4% of our population is Black and African American. So, but what I see the most is 2 areas. One, people over the age of 65, and then people on the kind of in the lower socioeconomic. Right? That's what we're seeing the most. The problem is that of our lower socioeconomic, the majority of those people are either Black or Hispanic. So when you start to see those challenges, those really a lot of times are the groups that we see the struggles with. But as I like to remind people all the time, we look at the population, but we treat the individual, right? So in order for us to have an effective healthcare system, we have to treat that we look at the population, we look at the neighborhoods, but we treat the individual, whoever comes in front of us, because each individual has a story, each individual has a challenge. I remember somebody coming to me on the phone. Now, this person has money, but they came to me with a problem. And then I brought that problem to a leader, and the person says, why they come to you? They got enough money, they can fix it. but that doesn't have anything to do with it. That person came to me because they had a problem that whatever amount of money they had couldn't solve. So is my response to be, you got a lot of money, you want to go fix it yourself? No, it's finding a primary care physician. That's what the person was struggling with, right? And I said, no. I said, we have to help that person find a physician. That's our job, right? Did they have the resources? They could go somewhere else? Yeah. They didn't want to go to New York. They didn't want to go to Vermont. They didn't want to go to Connecticut. They didn't want to go to Springfield. They wanted to come. They wanted their doctor to be at home. So, so I connected them with a person that could possibly help them. So, like I said, it's about the individual. And as long as we keep that in mind, whoever comes to us for help, that's who we help them. But we also recognize that certain particular groups have challenges, and we try to help.
All right, the last one. I mean,
Ready for it?
it's the last one on the sheet. You had your wish, and to be able to have people set aside their differences. And man, wouldn't it be amazing if we could all set aside our differences for just a moment and really connect with the humans and help each other out? But if you had a message that you could just say to the world in a short moment of what is something that you would say to the world to, I don't know, what would your message be?
My message has always been about honoring and treating people with dignity. Accepting people for who they are, coming with understanding, acknowledging whatever challenges they face, no matter who they are. I've really tried to kind of live my life in that way. Perfect? No. Make mistakes?
Wait a
yes.
second. What?
Make mistakes? Yes. That's always been, kind of my approach. I talk about it all the time. People will come to me, Charles, because they come to me now, they want to fix their teams, right? Charles, how do we fix our teams? I say, well, you tell everybody they got to treat everybody with dignity and look at me like I'm crazy, and it's not about just being nice to people. It's about being able to meet people where they're at, accept people for who they are. I struggle a lot of times because when I took on this role, the thing I always had to fight was when people would say to me, well, you know why you got that role, right? And then because of the color of my skin. And it would frustrate me, right? Because what I would always tell people is that if I believed that I got a job for that reason, if that even entered my mind, I would not take it. Because I want you to give me a job because you think that I'm qualified and I can do well at it. My CEO she said to me, do you know why I asked you to do this role? And I said, no. She says, we were on a panel discussion together and we were talking about bias. And she said, everybody else talked about themselves and their experience. She says, you were the only person to talk about someone else and how you helped someone else overcome a bias that people had about them. She said, when I heard you talk like that, she said, I knew you would be the person I would want for this role because you would be thinking about the other person. And, and I think, that's what I've tried to do. I'm fortunate, in my success from where I came from. And, but, I used to say, geez, I made it out, why can't you? I used to say that, right? But that's not fair because I don't know that person's experience. I don't know what that person's gone through. So now, for me, it's an opportunity to kind of be that helping hand, to be that person. Maybe I'm the person that opens the door for that person because I listen, because I have compassion, because I'm accepting, because I acknowledge what those challenges are for them. And when I act like a knucklehead, I can ask for forgiveness and try to right that wrong that I made. And just living by that philosophy is really what's helped me be hopefully a better person.
Charles, thank you so much for traveling an hour and a half out this way, hour and a half back out that way, just so that we could hear about what you do, why it matters. It's important for us to remember that people have their own individual struggles, and how effective it is when a whole community is interconnected with the services that they have, the things that they have, how to help someone get to BCC, how to help somebody get groceries, how to help somebody get a primary care doctor. All of those things are something that even those of us that are not operating in the Berkshires, we still come away with ideas on how we can meet people where they are and help them connect where they need to connect. So thank you.
So somebody asked me a question earlier today. I won't mention their names. And I think it's important to say it, because I don't know if it was necessarily asked of me. With everything that's going on out in the world today, how do I continue to do what I do every day? And, my answer is that I know in my heart that everything that I am doing is the right thing. And doing the right thing doesn't always mean the path's easy. Like, we know, we go to church every day. We know, Jesus, he was doing the right things, but the path was not easy, right? And I'm not saying my path's like Jesus, is just an example, right? You do the right thing, but a lot of times there's going to be roadblocks in doing those things.
Did you listen to my sermon today?
And I believe that myself and our health system is doing the right thing for the people in the community. We will face whatever we need to face. It's hard. I tell people all the time, we don't know what's happening one day to the next. So until somebody tells me I have to change my practice, we're going to continue. And I would say to them, I said, it doesn't matter what happens. These 3 hospitals and these 30-plus practices are going to be here to take care of you. I said, I'm going to be here when you need somebody to talk to. I'm going to continue to be here to help you. So, again, we get through what we need to get through, but I always believe that when you do what is right, eventually in the end, you're going to get to the place that you need to get to. You can't stray away from it. My boss says, do you want to change your title? And I said, no. I said, why am I changing my title? Now, if you come to me and say you're not going to get federal dollars, then I'm not going to be selfish and say, don't change my title. We do what we need to do. But I said, we let the community know that what we said in 2022 still stands strong in 2025. Is that we're here to care for you, and we're here to improve that care and improve your life. So I live by that. I say it every day. I say it to the people in the community. I tell them I'm not going anywhere unless they fire me. I'm not going anywhere. But, that's how I kind of get through kind of all of the quote-unquote craziness that people are feeling. When they just don't know what's going to happen, or they get information that maybe isn't correct, and I can correct that for them, or whatever that is. So, so that's how I push through every day.
Thank you, Charles. Let's give it up for Charles.
Thank you very much.
Thanks for coming. This is
my pleasure.